Special call-in show now on the coronavirus outbreak where we'll take your questions, and we have in studio with us Dr. Karan Madan, pulmonologist of AIIMS, to take all those questions. Now this comes after India's had its first coronavirus related death. A 76-year-old man from Kalburgi in Karnataka died on Tuesday night, and now it's been confirmed that he indeed had COVID-19. So doctor, lots of questions. I think also the point that we're trying to emphasize here on NDTV as well, when all these restrictions are being put in place, is that it can't be business as usual, and this requires all of us to change the way we behave, and especially this issue of social distancing, etc. Right, Dr. Madan?
Yeah. So I think this needs for actually the reinforcement of the precautions which we are taking, and need to spread more awareness so that people as such take those essential precautions to prevent the further spread of the disease, which is the most important step.
All right, and also calls for reducing the amount we're traveling, non-essential travel. This is the holiday time, so many people making travel plans, and the Prime Minister too has tweeted saying that avoid any sort of non-essential travel. We have our first caller from Delhi, Abhay, calling in. Go ahead with your question, Abhay.
Yeah, hi. Dr. Karan, my question is that I've just traveled from Mumbai to Delhi, that's where I live. So basically what's happened is that I've caught a little bit of a flu symptoms. I have cough, I have a little bit of sneezing, and there's no fever although. So I'm just worried that when should I start panicking and trying to go for a COVID-19 test. And secondly, my father is he's aged and he's also a heart patient. So should I take some precautions to stay away and things like that, or how should I go about it?
Right, Dr. Madan, what would you say?
So I think only the symptoms of some sneezing and some cold do not classify as symptoms of a severe acute respiratory infection or a kind of a severe flu. So I think it can also be a common cold which commonly happens. So if there are milder symptoms, they can improve usually with rest. And as you don't have any history of an international travel to a country in which the circulation is happening, so I think those symptoms are of a mild cold, and I think that happens with many people.
But since this is a flu season in a sense, because we also have had H1N1 cases, we've had people, of course, with the change of season catching a cold. At what point does one generally start worrying about coronavirus, or when does one get tested?
So I think as the thing is for flu also, there are a lot of viral illnesses which can present with such symptoms. So if the symptoms are very mild, they don't have a high-grade fever or severe respiratory symptoms like shortness of breath or intractable cough, those are the symptoms which are worrisome, which require sometimes hospitalization and testing. But for mild symptoms, even for a flu setting, the testing is routinely not recommended.
All right, we also have Amit Saxena calling in from Faridabad. Go ahead with your question.
Good morning.
Good morning.
Yesterday I just checked. We have few detection center, testing center in Delhi, and two in Delhi and one in Sonipat. So why can't we set up a testing center in each district? So each and every common man who has just symptoms of common flu and other things may go there freely and test. How can all the people can go to the AIIMS or other few testing centers available in Delhi NCR?
All right, that's an important question. I think this is something that's crossed many people's mind, especially when we, Doctor, look at the example of how South Korea treated the outbreak and how the US and South Korea, you have a lot of testing taking place. People can just walk in, get tested, and that's really helped control the upsurge in the coronavirus outbreak, whereas in US, it's much more limited. What would you say about in India? What are the facilities right now?
I think facilities are there, and as of now, as has been put forward, there's no conclusive evidence of a wide-scale community transmission happening. So I think there's a well laid down policy by the government as to who would be a suspect and who would be tested. So I think as of now, those measures are in place, and we should stick to that.
So you're saying that right now the cases that we have are people who have traveled from abroad, returned, and then they've been found to be suffering from coronavirus. So it's just them and whoever they've come in contact with, which is the worry. But do you think it will become a point, it could, if we see it spreading further, that private institutes will also, private medical facilities will also be allowed to test for it?
I think that one has to see how the situation evolves and how the number of cases changes. So I think one has to, first of all, not have a panic and just stick on to the basic hygiene precautions and see how the situation evolves.
All right, we have a caller, Karthik from Chennai. Go ahead, Karthik.
Yeah, Dr. Karan, good morning. My name is Karthik. I'm from Chennai. I am a cancer patient. I'm undergoing chemotherapy. So I am really scared about this whole thing. So is there anything special, patients like us need to take? Special care?
So I think that's an important question. People who are immunocompromised and people sometimes who are at extremes of ages, they are the ones who've had reported to have more issues with the COVID disease. So I think as the general precautions have been advised, one should avoid, avoiding exposure to a crowded place or coming in contact with patients who have an obvious symptom of a cold or a flu-like illness. And I think those are the basic hygiene precautions like hand wash and taking care of hand hygiene and cough etiquette. Those things are important. So I think those precautions are important, and avoid a close contact with anybody who's got symptoms with a flu or a respiratory.
And even the people who live in his house perhaps should be even more careful so that they don't become carriers or anything, because one of the worrying things is about how the symptoms may not even show you of this disease and you could still be a carrier.
I think that holds true for flu or influenza per se also. So I think if anybody who's got symptoms of flu and is in close contact with the immunocompromised person, with the person say who's got cancer or who's undergoing immunotherapy or immunosuppressive drugs, so I think those people should take more precautions that they don't spread the disease to the patient.
All right, we also have joining us on the phone line Nelson D'Souza from Bengaluru. Go ahead with your question.
Hello, doctor. I just want to ask a question. Usually the patients have been checked in the airports and other places. What about those people who are already infected and we do not know, and we are coming in contact with them and we are getting infected by them? So are there any measures taken by the government or anything like that? I just wanted to ask.
Right,
so
doctor?
So it's important to note that all the infections, if somebody, including the COVID infections, are not severe infections. In fact, a large majority of more than 80 to 85% or even larger are actually milder infections in which they just happen and they resolve. So and there are also other viral illnesses which present like a cold, like the influenza and the other circulating coronaviruses and viruses. So I think there is no need to panic per se, because most of the illnesses, even with the coronavirus, are actually mild illnesses.
All right, but at the same time, we have to be careful so that we don't become carriers and spread it to people who may be more vulnerable. Yes, because it's being talked about how, it's like a flu. Of course, we've had President Trump talking about how it's like a flu again and again. But even so, the worry is how quickly it spreads, and the fact that even young people who may have it could carry it on to people who may be more vulnerable.
Yeah, so those things are there, but I think that is why the basic infection control precautions are the most important step, so that people take care of their cough, they take care that they don't cough, in open surfaces, so that the spread may be minimized, taking care of the cough hygiene. So those are the most important steps, and they'll go a long way.
All right, we have with us two callers. We'll take both those questions. Satyanarayan Murthy from Bengaluru. Go ahead with your question.
My question is that.
Yes, go ahead.
Good morning, doctors.
Yeah, good morning. Yeah.
Sir, my name is Satyanarayan Murthy. My question is that I am a patient of IPF.
Mm-hmm. Okay, please
Right.
go ahead.
Actually, it is happening where I wanted to undergo the operation of the hernia.
Mm-hmm.
Is it vulnerable for any?
Okay, so your question is that you have what I got was IPF, that is idiopathic pulmonary fibrosis. So it's like a condition of the lungs in which there is some reduction of the lung volumes. It's kind of a chronic lung disease, and you are worried about whether you should go ahead for a planned surgery for a hernia. Is that your question?
My question is that is the time is good for undergoing any type of surgical operation?
Yes, so he basically wants to know whether he should undergo the surgery.
I think, see, if any procedure is medically indicated and is required, I think as of now there is no indication that the routine care of patients should not go on. So if you are otherwise fit for a medical condition of the lungs and a surgery is required, I think there is no contraindication to going ahead with that.
All right, maybe he was worried to be exposed in a hospital. We also have Pooja from Mumbai. Go ahead with your question, Pooja.
Hi, doctor. Good morning. I wanted to ask that people who are not even slightly affected with the virus, are they okay to wear the mask throughout the day, or is it not necessary?
I think this is a recurring question, Doctor. Go ahead.
A very important question, and it's so I think healthy people who don't have any symptoms are actually, it's not recommended for them to be routinely wearing a mask. It has been reiterated many times that an incorrectly worn mask may actually be not good, and it might increase your risk of getting an infection, because if you are putting your hands near the mouth and the face, trying to continuously adjust the mask. Mask would be useful for patients, people who have infected with a respiratory illness, so that they don't spread the infection to others, but not for the healthy people. It's not routinely recommended.
All right, I think this is something that's very important, because a lot of the images show people wearing masks, but many of those are affected people. It's not necessary for everyone to wear masks. We also had many of our MPs, going into Parliament wearing masks. We also have Sohan calling from Saharanpur. Go ahead with your question.
हेलो, ये सर नमस्कार सर।
जी
सर, मैं जानना चाहता हूँ, एक्चुअली देहरादून में मैंने अभी न्यूज़ देखा है कि वहाँ पे कोरोना वायरस एक डिटेक्ट हुआ है, तो मैं जानना चाहता हूँ कि मेरे को फैमिली के साथ वहाँ पे जाना है एक्चुअली, तो अभी जाना वहाँ पे सही रहेगा या नहीं? एक मैथ इंदेश हॉस्पिटल है देहरादून में जहाँ पे एक पेशेंट डिटेक्ट हुआ है अभी कोरोना वायरस का।
All right, so that again, many people traveling to various places, the cases in Rajasthan, now one case he's saying in Dehradun. What would you say, doctor?
So I think, see, essential travel and all those things are going on, and they are a part of normal life, which will go on. So I think there's no such evidence per se that a widespread you should avoid such a thing. If it's essential, I think one can go ahead and.
All right, so one can go ahead. I mean, just because there's one particular case, it doesn't mean that you stop traveling to those cities and take all precautions. I think that's a worry that many people have. We have Ronnie calling in from Kolkata. Go ahead with your question.
Yeah, hello, doctor. I just wanted to ask that we have been told that only if you are not a coronavirus infected person, not to wear a mask. But the thing is, if we are traveling in a public place or in a metro or wherever, and if a person who is infected by coronavirus and he doesn't know that he has coronavirus, so won't the disease be transmitted to the other people? Because that person is not wearing a mask, neither the person who is not infected. So in that way, isn't it a contradictory statement with the government, the health minister, saying that not to wear a mask, but but it can be so that you have to wear a mask, because outside in international outside you can see that everybody is wearing a mask when they are out in the public place.
Right, doctor. Again, this is going to be a recurring question. Go ahead.
So I think that would not, I think, be a correct statement. I think the most important route of transmission of this virus, one has to understand, is not by an airborne infection. It's by actually droplets, and droplets mean that when an infected person coughs or sneezes, the droplets get deposited, and it's actually through your hands, most importantly, that you are likely to introduce this virus into your body by contacting the infected hands with your mucosal surfaces. So I think hand hygiene is very important, and that is why
not touching your face. I think that's something that has been emphasized.
Yes, touching your face and eyes is important. So you should not do that. That is why wearing a mask for healthy people is not the most important preventive strategy.
All right, we have Sanjeev from Gurugram. Go ahead with your question.
Yeah, good morning, doctor.
Good morning.
Actually, I returned from Malaysia on 6th of February. And I have been having a kind of, I would say, constant cough, and kind of it's not a dry cough, but I have been like, there is no temperature or nothing, but it is not actually going away, and I have taken whatever precautions in terms of homemade remedies like Shira and all that, and I normally work from home. So, is there any advice? What should I do about this?
So, if there's a history of a recent travel and you've got new onset respiratory symptoms, I think one should approach the helpline, and I should think if there is a possible exposure, then I think that may be taken care of, and necessary testing if required would be done. Many of the times, if the exposure was quite old and the history of travel was, say, 15 days or longer, then it is possible that it might be a residual symptom following a viral infection. But I think in any case, if in case you have a history of an international travel, you have respiratory symptoms, it's important to approach and get yourself, evaluated.
All right. Well, thank you so much, Dr. Madan, for taking everyone's questions. And clearly, many people have lots of doubts. And of course, there's worry given the kind of steps that have been put in place. But thank you again for joining us. Well, that's all the time we have today on the show.